In our population, around 12% of people will have experienced 4 or more adverse childhood experiences. And what that tells us from the studies is that the people who've experienced 4 or more ACEs are much more likely to be at risk of ill health. The real important thing for us about the ACEs work is the shift in understanding what's happened to people, that it's not their fault, and that we'll work together with you to build your resilience and to cope with the other things that might come your way. We wanted to try and work in a new way using the Our Manchester approach to try and bring people together, to tackle complex problems together and to really listen to people in the communities and work with them to try and overcome some of the difficulties they're facing.
It's a proper community hub in Harper Hay with lots of people who want to make a difference. If we can develop a workforce who have an understanding of adverse childhood experiences and know how to work in a trauma-informed way, can we make a difference to residents? So I went round a number of schools, the college, nursery provision, health visitors to school nurses, youth and voluntary sector, anybody who I could find who I thought has a role to play in improving the lives of Harper Hay residents, and would they be interested initially in coming on some training.
So we're a large primary school in North Manchester. We've got a lot of long-serving staff who know our families and they know the challenges that our community faces. Half of our staff have now attended the ACE awareness training, and this has had a huge impact for us this year. It's helped us to work flexibly with children. It's helped us to stay with children when they're in crisis. So it really helps us meet the challenge of mental health. One of the most significant changes is the way we've responded in terms of short-term exclusions. We've stepped away from that. We're trying to stay with the child when they're in crisis and work through what happened, focus on the repair and how we can make things better.
Our job role came up within the community safety team to work with hoarders and try a different approach at supporting them. We was asked to go on some ACEs training, knowing that we had to find a trigger for why they was hoarding. We always looked at from the adulthood going upwards. When we went on the training, they mentioned about childhood traumas, and after the training we found that almost all of our tenants that was hoarders had childhood issues, and when we spoke about them we found we had more progression with clearing the hoard. Through spending that time with them, they trusted us, and it really made a big impact on how we was working.
Within Harper Hay, we know that we are in the top 10 within the country for deprivation, and we have a high risk of domestic abuse within the community as well. Acknowledging ACEs becomes a part of that because we're actually searching for health needs within families and then signposting or referring on as needed really. When you are working with a challenging family and you're discovering ACEs, you can eradicate certain things and you can help that family and you can see that success. It's a really nice feeling that you are actually making that difference. There's a proverb that it doesn't take one family to raise a child, it takes a village. Well, you know, that's what we're doing.
I can honestly say this is the most positive experience I've had, the most positive projects I've worked with, and the one that's making the biggest difference to individuals, families and the community. Our Manchester is all about working with communities and this strength-based approach and positive conversations and having a go at stuff.
This isn't just a one-off project, this is a whole approach to the way that we're working, and I feel in my career I'm most excited about this project than I've ever been about anything else. I'm so passionate to bring it to Manchester and really want it to continue in the future going forward.